Medical assistant exam anatomy and physiology. Question 1. After reviewing the situation in a primary care office, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A. First drops of urine into an unclean container. Option B. Specimen collected from the toilet bowl. Option C. A random sample from an old urinal. Option D. Clean catch midstream specimen. The correct answer is option D. Clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Initial urine can carry contaminants and an unclean container is inappropriate. Toilet water contaminates the specimen. Old specimens may be contaminated and may not reflect current results. Question 2. Following office protocol in a community health clinic, a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A. Administer the medication because it was ordered. Option B. Ask the patient to sign a form and give it anyway. Option C. Change the medication to another drug independently. Option D. Hold the medication and notify the provider. The correct answer is option D. Hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. An order does not override a possible allergy. A form does not make an unsafe medication appropriate. Medical assistants do not independently substitute medications. Question 3. At the start of care in an exam room, a used needle must be discarded after an injection. Which practice is safest? Option A. Carry the needle to the front desk for disposal. Option B. Recap the needle with both hands. Option C. Place the needle in regular trash. Option D. Activate the safety device and place the needle in a sharps container. The correct answer is option D. Activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Transporting exposed sharps through the office increases risk. Two-handed recapping increases needle stick risk. Sharps can injure staff and must not go into regular trash. Question 4. Before the visit continues in a medication administration visit, a staff member shares an electronic health record password to save time. Which risk is created? Option A. Better sterilization monitoring. Option B. Loss of accountability for chart access. Option C. Improved privacy protection. Option D. Automatic insurance approval. The correct answer is option B. Loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Login credentials do not sterilize instruments. Password sharing weakens privacy and security. Passwords do not control payer authorization. Question 5. After reviewing the situation in an electronic health record review, a patient wants information released to a spouse. Which documentation is usually needed? Option A. A note written by the assistant after the fact. Option B. A verbal request from the spouse only. Option C. No documentation because spouses always have full access. Option D. A valid authorization or permission according to office policy. The correct answer is option D. A valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. Authorization should come from the patient or legal authority. The spouse's request alone may not authorize release. Relationship alone does not automatically grant full access to records. Question 6. For a patient encounter in a women's health clinic, a patient asks for a copy of their medical record. Which action should the assistant take? Option A. Refuse because records belong only to the provider. Option B. Delete sensitive information before the request is reviewed. Option C. Follow the office release of information process. Option D. Give the record to anyone who asks. The correct answer is option C. Follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Patients have rights to access their health information under applicable rules. Altering the record is inappropriate and may violate legal requirements. Identity and authorization must be verified before disclosure. Question 7. After reviewing the situation in a medical office workflow, an intramuscular injection is ordered for an adult. Which site may be used according to protocol? Option A. The fingernail bed. Option B, deltoid muscle when the medication and volume are appropriate. Option C, inside a visible vein. Option D, a reddened rash site. The correct answer is option B, deltoid muscle when the medication and volume are appropriate. The deltoid can be used for certain adult intramuscular injections when volume and medication are suitable. The fingernail bed is not an intramuscular injection site. A vein is used for intravenous access, not intramuscular injection. Irritated or infected skin should generally be avoided. Question 8. A medical assistant is working in a medication administration visit when an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A, erase the value because it may worry the patient. Option B, tell the patient that hypertension has been diagnosed. Option C, send the patient home to rest without notifying anyone. Option D, recheck using proper technique and report the finding according to protocol. The correct answer is option D, recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Accurate documentation is required even when the value is abnormal. Medical assistants do not diagnose conditions based on one reading. Abnormal readings require appropriate follow-up rather than dismissal. Question 9. Following office protocol in an administrative check-in area, a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A, refer the question to the provider. Option B, suggest using a friend's medication. Option C, recommend doubling the dose instead. Option D, tell the patient to stop immediately. The correct answer is option A, refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Sharing medication is unsafe and inappropriate. Changing a dose without provider order is unsafe and outside scope. Directing medication discontinuation is outside the assistant role. Question 10. The care team in a family practice clinic asks for guidance because a tourniquet has been in place for more than 1 minute before venipuncture. Which action is safest? Option A, tighten it further until the vein bulges. Option B, move it over the venipuncture site. Option C, ignore the time because tourniquets do not affect tests. Option D, release it and allow the arm to recover before continuing. The correct answer is option D, release it and allow the arm to recover before continuing. Prolonged tourniquet time can cause hemoconcentration and affect test results. More pressure can increase discomfort and alter specimen quality. A tourniquet is placed above the site, not over the puncture area. Tourniquet time can affect certain laboratory values. Question 11. Given the workflow in a walk-in clinic, the assistant is comparing two needle gauges. Which statement is accurate? Option A, a larger gauge number always means a longer needle. Option B, gauge has no relation to needle size. Option C, all injections use the same gauge. Option D, a smaller gauge number indicates a larger needle diameter. The correct answer is option D, a smaller gauge number indicates a larger needle diameter. Needle gauge numbers are inverse to diameter, so lower numbers are wider. Gauge describes diameter, not length. Gauge specifically describes needle diameter. Needle gauge varies by medication, route, and patient factors. Question 12. While working in a family practice clinic, the assistant is reviewing the function of red blood cells. Which role is most accurate? Option A, transport oxygen. Option B, produce bile. Option C, filter lymph. Option D, create antibodies as their main role. The correct answer is option A, transport oxygen. Red blood cells contain hemoglobin, which carries oxygen to tissues. Bile is produced by the liver and stored in the gallbladder. Lymph nodes filter lymph rather than red blood cells producing this function. Antibody production is associated with certain white blood cells and plasma cells. Question 13. As part of exam preparation in a quality control review, the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A, stop and resolve the discrepancy before proceeding with care. Option B, continue if the last name matches. Option C, correct the date of birth without asking anyone. Option D, use the appointment time as the identifier. The correct answer is option A, stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. A last name alone does not rule out an identity error. Changing demographic data without verification may create a documentation error. Appointment times are scheduling data and are not approved identifiers. Question 14. To protect safety in a medication administration visit, the provider requests an adult radial pulse during intake. Which technique should the medical assistant use? Option A. Use the thumb to feel the pulse. Option B. Place 2 or 3 fingers over the radial artery at the wrist. Option C. Place the stethoscope over the abdomen. Option D. Count respirations before locating the pulse. The correct answer is option B. Place 2 or 3 fingers over the radial artery at the wrist. The radial artery at the thumb side of the wrist is commonly used for an adult pulse. The thumb has its own pulse and can interfere with accurate counting. The abdomen is not used for a routine radial pulse. Respirations are measured separately and do not identify the pulse site. Question 15. Before the visit continues in a diagnostic testing area, a patient is suspected of having tuberculosis. Which type of precautions is most appropriate? Option A. Droplet precautions only. Option B. Contact precautions only. Option C. Reverse isolation for staff protection only. Option D. Airborne precautions. The correct answer is option D. Airborne precautions. Tuberculosis can spread through airborne particles and requires airborne precautions with appropriate respiratory protection. Droplet precautions do not address smaller airborne particles that can remain suspended. Contact precautions focus on direct or indirect touch transmission and are not enough for tuberculosis. Reverse isolation protects immunocompromised patients rather than controlling tuberculosis spread. Question 16. Given the workflow in a primary care office, the assistant reviews the path of blood leaving the right ventricle. Which vessel receives it? Option A. Superior vena cava. Option B. Aorta. Option C. Pulmonary vein. Option D. Pulmonary artery. The correct answer is option D. Pulmonary artery. The pulmonary artery carries deoxygenated blood from the right ventricle to the lungs. The superior vena cava returns venous blood to the right atrium. The aorta carries oxygenated blood from the left ventricle to the body. Pulmonary veins return oxygenated blood from the lungs to the left atrium. Question 17. As part of exam preparation in a patient education session, the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A. Appendix. Option B. Urinary bladder. Option C. Thyroid gland. Option D. Gallbladder. The correct answer is option C. Thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The appendix does not produce thyroid hormone. The urinary bladder stores urine and does not produce thyroid hormone. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. Question 18. After reviewing the situation in a walk-in clinic, the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A. Otoscope. Option B. Speculum for pelvic exam. Option C. Ophthalmoscope. Option D. Spirometer. The correct answer is option A. Otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. A vaginal speculum is not used to inspect the ear canal. An ophthalmoscope is used to examine internal eye structures. A spirometer evaluates lung function rather than the ear. Question 19. During a same-day appointment, a student asks which blood component helps with clotting. Which answer is correct? Option A. Alveoli. Option B. Neurons. Option C. Platelets. Option D. Plasma glucose. The correct answer is option C. Platelets. Platelets help form clots and support hemostasis. Alveoli are lung structures involved in gas exchange. Neurons transmit nerve signals and are not blood clotting cells. Glucose is a blood sugar and does not form clots. Question 20. As part of exam preparation in a clinical skills review, the term cardiology appears in a referral. Which specialty is involved? Option A. Heart and cardiovascular system. Option B. Skin disorders. Option C. Kidney disorders. Option D. Digestive disorders. The correct answer is option A. Heart and cardiovascular system. Cardiology focuses on the heart and cardiovascular system. Dermatology focuses on the skin. Nephrology focuses on the kidneys. Gastroenterology focuses on the digestive system. Question 21. Before the visit continues in an infection control audit, a patient is placed lying face down for a back examination. Which position is being used? Option A, Fowler. Option B, lithotomy. Option C, prone. Option D, supine. The correct answer is option C, prone. Prone means lying on the abdomen with the face downward. Fowler is a seated or semi-seated position. Lithotomy involves legs in stirrups for certain pelvic procedures. Supine means lying on the back. Question 22. When a patient encounter unfolds in a preventive care visit, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A, every morning. Option B, by mouth. Option C, immediately. Option D, as needed. The correct answer is option D, as needed. PRN means the medication is taken as needed according to the order. Every morning is commonly abbreviated differently and is not PRN. By mouth is PA. Immediately is STAT in common medical usage. Question 23. During a family practice clinic, the term hypertension appears in the problem list. Which meaning is correct? Option A, slow breathing. Option B, low blood glucose. Option C, joint inflammation. Option D, high blood pressure. The correct answer is option D, high blood pressure. Hypertension means blood pressure above the normal range or treatment threshold identified by the provider. Slow breathing is bradypnea. Low blood glucose is hypoglycemia. Joint inflammation is arthritis. Question 24. After reviewing the situation in a telephone triage workflow, the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A, pulse and respirations. Option B, oxygen saturation and pain score. Option C, height and weight. Option D, blood pressure and temperature. The correct answer is option C, height and weight. Body mass index is calculated from height and weight. Pulse and respirations are vital signs but are not used to calculate body mass index. Oxygen saturation and pain score provide different clinical information. Blood pressure and temperature do not determine body mass index. Question 25. To protect safety in a patient intake station, an electronic record uses an audit trail. What is its purpose? Option A, approve insurance claims instantly. Option B, measure blood pressure. Option C, track who accessed or changed information. Option D, sterilize instruments automatically. The correct answer is option C, track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Payer claims processing is separate from record audit logs. Vital sign measurement requires clinical equipment and technique. Audit trails do not process instruments. Question 26. A medical assistant is working in a primary care office when the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A, thyroxine. Option B, melatonin. Option C, estrogen. Option D, insulin. The correct answer is option D, insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Thyroxine is a thyroid hormone involved in metabolism. Melatonin is associated with sleep-wake cycles. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Question 27. For a patient encounter in a pediatric clinic, a subpoena for medical records arrives at the office. Which response is best? Option A, ask the receptionist to summarize the chart from memory. Option B, immediately fax the entire chart without review. Option C, ignore it because subpoenas never apply to clinics. Option D, give it to the provider or designated privacy officer for proper handling. The correct answer is option D, give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Summaries from memory are unreliable and not an appropriate legal response. Records should not be released without verifying legal requirements and scope. Subpoenas can require action and should not be ignored. Question 28. At the start of care in a medical office workflow, office supplies are consistently running out before the next order date. Which administrative action is best? Option A, order random supplies without reviewing use. Option B, track usage and adjust par levels according to office needs. Option C, hide supplies from the provider. Option D, wait until every item is completely gone. The correct answer is option B, track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Unplanned ordering can waste money and storage space. Hiding supplies does not solve inventory management. Waiting can interrupt patient care and office workflow. Question 29. To protect safety in a patient education session, soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A, gloves completely replace hand hygiene. Option B, soap and water help remove spores more effectively from the hands. Option C, hand washing is needed only before eating. Option D, alcohol sanitizer is always illegal in clinics. The correct answer is option B. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Gloves reduce exposure but do not replace hand hygiene after removal. Hand hygiene is required at multiple points in patient care. Alcohol-based hand rubs are appropriate for many routine situations. Question 30. Following office protocol in a phlebotomy station, muscle tremor artifact appears on an electrocardiogram tracing. Which intervention may improve the tracing? Option A, help the patient relax and support the limbs. Option B, place the paper speed at 0. Option C, ask the patient to tense all muscles. Option D, remove all electrodes during the recording. The correct answer is option A, help the patient relax and support the limbs. Muscle tension and movement can create artifact, so comfort and support may improve tracing quality. Paper movement is needed to record the waveform. Tensing muscles increases electrical artifact. Electrodes are required to capture the tracing. Question 31. An office review in a phlebotomy station shows that a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A, Fowler. Option B, supine. Option C, Sims. Option D, prone. The correct answer is option B, supine. Supine means lying on the back facing upward. Fowler position is seated or semi-seated. Sims position is side-lying with one knee flexed. Prone means lying face down. Question 32. As part of exam preparation in a busy front office, a pelvic examination is scheduled. Which patient position is commonly used? Option A, Sims. Option B, lithotomy. Option C, Trendelenburg. Option D, prone. The correct answer is option B, lithotomy. The lithotomy position is commonly used for pelvic examinations. Sims position is often used for rectal procedures or enemas. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Prone means lying face down and is not the common pelvic exam position. Question 33. When a patient encounter unfolds in a specialty referral visit, a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A, speak quietly and avoid announcing sensitive details. Option B, place all charts open on the counter. Option C, state the full diagnosis loudly to confirm the visit. Option D, ask other patients to help verify the record. The correct answer is option A, speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Open charts may expose protected information. Announcing diagnoses in public can violate confidentiality. Other patients should not be involved in private verification. Question 34. While working in a medication administration visit, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A, patient intake form. Option B, insurance remittance advice. Option C, appointment reminder template. Option D, safety data sheet. The correct answer is option D, safety data sheet. The safety data sheet gives hazard, handling, storage, and spill response information for chemicals. An intake form does not provide chemical safety instructions. Remittance advice explains payment decisions, not chemical hazards. Reminder templates do not address workplace chemical safety. Question 35. A medical assistant is working in a women's health clinic when a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A. Ask the patient to jump to the table. Option B. Lock the wheelchair and use proper body mechanics with assistance as needed. Option C. Leave the wheelchair unlocked for easier movement. Option D. Pull the patient by the arms quickly. The correct answer is option B. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Jumping is unsafe and unrealistic for a transfer. An unlocked wheelchair can roll and cause a fall. Pulling can injure the patient and the assistant. Question 36. When a patient encounter unfolds in a same-day appointment, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A. Reaching across the sterile field with an unsterile sleeve. Option B. Keeping sterile items above waist level. Option C. Using sterile forceps for sterile supplies. Option D. Opening the wrapper away from the body first. The correct answer is option A. Reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile items are generally kept in view and above waist level. Sterile forceps can help maintain asepsis when used correctly. Opening the far flap first is a common way to avoid reaching over the field. Question 37. During a walk-in clinic, the medical assistant takes a phone message for the provider. Which information is most important to include? Option A. Caller identity, contact information, reason for call, and urgency. Option B. The assistant's guess about the diagnosis. Option C. Only the caller's first name. Option D. A promise that medication will be prescribed. The correct answer is option A. Caller identity, contact information, reason for call, and urgency. Complete phone messages help the provider triage and respond appropriately. Diagnosis should not be guessed in a phone message. A first name alone may not identify the patient or issue. Medication decisions belong to the provider. Question 38. During a quality control review, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A. Give the patient food to push it down. Option B. Encourage coughing and monitor closely. Option C. Perform blind finger sweeps immediately. Option D. Leave the patient alone until they stop coughing. The correct answer is option B. Encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. Food can worsen the obstruction. Blind finger sweeps can push the object deeper and are not appropriate. The patient should be monitored because the obstruction may worsen. Question 39. After reviewing the situation in a same-day appointment, a multi-dose vial has no date after being opened. Which action is most appropriate? Option A. Guess the opening date from memory. Option B. Follow facility policy and do not use it if safety cannot be verified. Option C. Mix it with another vial to avoid waste. Option D. Use it because the cap is still attached. The correct answer is option B. Follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. Guessing creates unsafe documentation. Combining vials can contaminate medication and is not appropriate. The cap does not prove when the vial was opened or whether it was stored correctly. Question 40. While working in a same-day appointment, the assistant teaches a patient how to prepare for a fasting laboratory test. Which method best confirms understanding? Option A. Give instructions as quickly as possible. Option B. Use medical jargon to sound professional. Option C. Ask the patient to explain the instructions back in their own words. Option D. Ask only whether the patient has any questions. The correct answer is option C. Ask the patient to explain the instructions back in their own words. Teach back checks whether the patient understood the instructions and allows correction of misunderstandings. Rushing can reduce comprehension. Jargon can confuse patients and reduce understanding. Patients may say no even when they misunderstand instructions. Question 41. When a patient encounter unfolds in a diagnostic testing area, an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A. Beneficence. Option B. Abandonment. Option C. Respondeat superior. Option D, patient autonomy. The correct answer is option D, patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Beneficence means acting for the patient's good but does not override a competent refusal. Abandonment involves ending care without proper notice or support. Respondeat superior concerns employer responsibility for employee actions. Question 42. In a walk-in clinic, a pregnancy test performed in the office is classified as waived testing. Which requirement still applies? Option A, use expired kits if the package is unopened. Option B, skip controls because waived means unregulated. Option C, follow manufacturer instructions and quality control policy. Option D, report results before the test develops. The correct answer is option C, follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Expired test kits may give unreliable results. Waived status does not eliminate quality responsibilities. Reading before the correct time can produce inaccurate results. Question 43. A medical assistant is working in an outpatient laboratory when a patient asks for printed medication instructions. Which practice improves health literacy? Option A, use clear language and review the key points with the patient. Option B, use only complex medical terminology. Option C, provide instructions in the wrong language. Option D, tell the patient to search online without guidance. The correct answer is option A, use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Complex terms can reduce comprehension. Language mismatch can prevent safe understanding. Unguided online searching may provide inaccurate or confusing information. Question 44. Given the workflow in a diagnostic testing area, a chain of custody urine drug screen is collected. Which practice is most important? Option A, document each transfer and maintain specimen integrity. Option B, use an unlabeled container until the lab receives it. Option C, skip signatures if the specimen looks normal. Option D, allow the patient to take the specimen home first. The correct answer is option A, document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Unlabeled specimens can be rejected and cannot be reliably traced. Appearance does not replace custody documentation. Uncontrolled possession breaks specimen integrity. Question 45. Given the workflow in a clinical skills review, blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A, label the empty tube as collected. Option B, gently adjust the needle position while maintaining safety. Option C, probe aggressively until blood returns. Option D, remove the tourniquet and continue filling all tubes. The correct answer is option B, gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. A tube without the required specimen must not be labeled as completed. Excessive probing can injure tissue and increase patient discomfort. Without blood flow, the collection cannot continue effectively. Question 46. While working in a same-day appointment, a minor arrives without a parent for a non-urgent visit. Which action is best? Option A, refuse all care without considering exceptions. Option B, assume all minors can consent to every service. Option C, follow state law and office policy for consent requirements. Option D, ask another patient in the waiting room to consent. The correct answer is option C, follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Some laws allow minors to consent for certain services. Minor consent is not universal for all services. Other patients cannot provide consent for the minor. Question 47. To protect safety in a quality control review, a small fire starts in a trash can at the clinic. Which acronym guides the initial fire response? Option A, SOAP. Option B, NPO. Option C, PRN. Option D, RACE. The correct answer is option D, RACE. RACE stands for Rescue, Alarm, Contain, and Extinguish or Evacuate depending on policy. SOAP is a documentation format and does not guide fire response. NPO means nothing by mouth and is unrelated to fire safety. PRN means is needed and does not guide emergency fire response. Question 48. During a family practice clinic, a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A. Give medication first and ask about allergies later. Option B. Ignore the band if the patient seems healthy. Option C. Remove the band so it does not worry the patient. Option D. Verify the allergy information in the record and with the patient. The correct answer is option D. Verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Allergies must be checked before administration. Allergy risk is not based on appearance. Removing an alert without direction can create risk. Question 49. At the start of care in a treatment room, the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A. The patient will automatically faint. Option B. The oral temperature will decrease. Option C. The reading may be inaccurate. Option D. The pulse oximeter will stop working. The correct answer is option C. The reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Cuff placement does not change oral temperature. Blood pressure cuff alignment does not control the pulse oximeter. Question 50. Given the workflow in an electronic health record review, a reagent bottle is past its expiration date. Which action is appropriate? Option A. Change the expiration date on the label. Option B. Use it only for abnormal patients. Option C. Do not use it for patient testing. Option D. Mix it with a new reagent to strengthen it. The correct answer is option C. Do not use it for patient testing. Expired reagents can produce inaccurate results and should be handled according to policy. Altering dates is unsafe and unethical. Expired reagents are not reliable for any patient testing. Mixing reagents without approval can invalidate testing. Question 51. In a telephone triage workflow, the assistant reviews the normal pacemaker of the heart. Which structure is identified? Option A. Ureter. Option B. Sinoatrial node. Option C. Alveolus. Option D. Gallbladder. The correct answer is option B. Sinoatrial node. The sinoatrial node normally initiates the heart's electrical impulse. A ureter carries urine from kidney to bladder. An alveolus is a lung air sac. The gallbladder stores bile and is not cardiac conduction tissue. Question 52. In an exam room, the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A. Above normal. Option B. Against. Option C. Before. Option D. Below normal or deficient. The correct answer is option D. Below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Above normal is indicated by hyper. Against is indicated by anti. Before is indicated by pre. Question 53. After reviewing the situation in a primary care office, a patient develops hives, wheezing, and swelling after an injection. Which action is most appropriate? Option A. Ignore the symptoms if the injection site looks clean. Option B. Schedule a routine follow-up for next week. Option C. Notify the provider and activate emergency protocol immediately. Option D. Tell the patient to drive home and rest. The correct answer is option C. Notify the provider and activate emergency protocol immediately. These findings can indicate anaphylaxis and require urgent response. Systemic allergic symptoms matter even if the injection site appears normal. Potential anaphylaxis cannot be delayed for routine follow-up. Respiratory symptoms and swelling require immediate attention. Question 54. While working in an administrative check-in area, the term nephrology appears in a referral. Which specialty is involved? Option A. Ears. Option B. Kidneys. Option C. Eyes. Option D. Bones. The correct answer is option B. Kidneys. Nephrology is the specialty focused on kidney function and disease. Otolaryngology focuses on ear, nose, and throat conditions. Ophthalmology focuses on eyes. Orthopedics focuses on the musculoskeletal system. Question 55. A medical assistant is working in a patient intake station when the provider discusses gas exchange in the lungs. Which structure is primarily responsible? Option A, alveoli. Option B, ureters. Option C, villi. Option D, tendons. The correct answer is option A, alveoli. Alveoli are tiny air sacs where oxygen and carbon dioxide are exchanged. Ureters carry urine from the kidneys to the bladder. Villi increase absorption in the small intestine. Tendons connect muscle to bone. Question 56. Before the visit continues in a busy front office, a patient asks which body system includes the skin. Which system should be identified? Option A, endocrine system. Option B, integumentary system. Option C, respiratory system. Option D, urinary system. The correct answer is option B, integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The endocrine system is made of hormone-producing glands. The respiratory system supports breathing and gas exchange. The urinary system filters blood and eliminates urine. Question 57. The care team in a quality control review asks for guidance because a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A, appropriate marketing. Option B, quality control testing. Option C, routine scheduling. Option D, breach of confidentiality. The correct answer is option D, breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Quality control relates to test system accuracy, not social media disclosure. Scheduling does not involve posting private health information publicly. Question 58. To protect safety in a cardiology practice, the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A, painful or difficult urination. Option B, ear inflammation. Option C, excessive thirst. Option D, difficulty swallowing. The correct answer is option A, painful or difficult urination. Dysuria refers to pain or difficulty with urination. Ear inflammation is otitis. Excessive thirst is polydipsia. Difficulty swallowing is dysphagia. Question 59. After reviewing the situation in a community health clinic, a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A, use the instruments if the package is dry. Option B, reprocess the instruments before use. Option C, open the package and rinse the instruments. Option D, write a new date on the package. The correct answer is option B, reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. A dry package alone does not override an expiration policy. Rinsing does not restore sterility. Changing the date without reprocessing is unsafe and misleading. Question 60. For a patient encounter in a patient education session, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A, refuse to document relevant information. Option B, tell the patient the practice is foolish. Option C, assume all people from that culture act the same. Option D, ask respectful questions and avoid judgment. The correct answer is option D, ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Relevant patient information should be documented according to policy. Judgmental language damages trust and may prevent disclosure. Stereotyping ignores individual differences. Question 61. While working in a clinical skills review, the term gastroenterology appears in a referral. Which specialty is involved? Option A, digestive system. Option B, urinary bladder only. Option C, endocrine glands. Option D, a nervous system. The correct answer is option A, digestive system. Gastroenterology focuses on the digestive tract and related disorders. Urology focuses on the urinary tract and male reproductive system. Endocrinology focuses on hormone-producing glands. Neurology focuses on the nervous system. Question 62. A medical assistant is working in an electronic health record review when a wet floor is noticed near the reception desk. Which action best prevents injury? Option A, wait until a patient reports slipping. Option B, place a warning sign and arrange cleanup immediately. Option C, cover it with loose papers. Option D, ignore it because it is not in an exam room. The correct answer is option B. Place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Prevention should occur before an injury happens. Loose paper can worsen slipping and does not clean the hazard. Safety hazards matter throughout the facility. Question 63. An office review in an urgent care office shows that a medical assistant leaves a computer screen open with patient information visible. Which safeguard would help prevent this issue? Option A, keep the screen facing the waiting room. Option B, lock the workstation before stepping away. Option C, share passwords with trusted co-workers. Option D, disable audit trails to speed workflow. The correct answer is option B. Lock the workstation before stepping away. Locking the workstation protects electronic protected health information from unauthorized viewing. Visible screens increase privacy risk. Shared passwords weaken accountability and violate security practices. Audit trails support security monitoring and should not be disabled by staff. Question 64. After reviewing the situation in a primary care office, a medical assistant prepares to administer an injection. Which set best represents medication rights? Option A, right color of vial and right storage shelf. Option B, right insurance, right copay, right appointment, and right room. Option C, right diagnosis only. Option D, right patient, right medication, right dose, right route, right time, and right documentation. The correct answer is option D, right patient, right medication, right dose, right route, right time, and right documentation. The medication rights are safety checks used to prevent administration errors. Vial appearance and shelf location are not sufficient medication rights. Administrative details do not replace medication safety checks. Diagnosis alone is not enough to confirm safe administration. Question 65. To protect safety in an urgent care office, the suffix ectomy appears in a procedure term. Which meaning is most accurate? Option A, abnormal softening. Option B, inflammation. Option C, visual examination. Option D, surgical removal. The correct answer is option D, surgical removal. Ectomy means surgical removal of a structure. Abnormal softening is indicated by malacia. Inflammation is indicated by itis. Visual examination is often indicated by scopy. Question 66. The care team in a women's health clinic asks for guidance because the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A, high blood sugar. Option B, slow heart rate. Option C, inflammation of the liver. Option D, fast breathing. The correct answer is option B, slow heart rate. The prefix brady means slow, and cardia refers to the heart. High blood sugar is hyperglycemia. Inflammation of the liver is hepatitis. Fast breathing is tachypnea rather than bradycardia. Question 67. Before the visit continues in a medication administration visit, the suffix itis appears in a medical term. Which meaning is most accurate? Option A, pain. Option B, removal. Option C, inflammation. Option D, study of. The correct answer is option C, inflammation. The suffix itis generally means inflammation. Pain is commonly indicated by the suffix algia. Removal is commonly indicated by the suffix ectomy. Study of is commonly indicated by the suffix logi. Question 68. In an administrative check-in area, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A, update the preferred pharmacy after verifying the new information. Option B, choose the pharmacy closest to the clinic. Option C, leave the old pharmacy because it is already in the chart. Option D, delete all pharmacy information from the record. The correct answer is option A, update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. The preferred pharmacy should come from the patient rather than staff convenience. Outdated demographic information can delay medication access. Removing needed information can interrupt prescribing workflows. Question 69. Following office protocol in a community health clinic, a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A, Trendelenburg is the only routine choice. Option B, Fowler position. Option C, prone position. Option D, lithotomy position. The correct answer is option B, Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Prone places the patient face down and may worsen breathing comfort. Lithotomy is used for pelvic procedures and does not primarily support breathing. Question 70. The care team in a pediatric clinic asks for guidance because the provider discusses the function of white blood cells. Which role is most accurate? Option A, store bile for digestion. Option B, carry oxygen as their primary job. Option C, help defend against infection. Option D, produce insulin in the pancreas. The correct answer is option C, help defend against infection. White blood cells are immune cells that help protect the body from infection. Bile storage is a gallbladder function. Oxygen transport is mainly the role of red blood cells. Insulin production occurs in pancreatic beta cells, not white blood cells. Question 71. When a patient encounter unfolds in a medical office workflow, a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A, record the measurements using the unit required by the office protocol. Option B, record height only because weight changes often. Option C, round weight to the nearest 10 pounds. Option D, use the parent's estimate if the scale is nearby. The correct answer is option A. Record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Both height and weight may be needed for clinical assessment. Large rounding errors can create unsafe dose calculations. Estimated weight is less reliable than a measured value. Question 72. After reviewing the situation in a diagnostic testing area, a specimen must be protected from light after collection. Which handling method is appropriate? Option A, wrap the specimen in foil or use an amber container as directed. Option B, leave the specimen uncovered at the front desk. Option C, place the tube in direct sunlight to warm it. Option D, shake the specimen vigorously for 1 minute. The correct answer is option A. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Delayed or improper handling can compromise results. Sunlight can degrade light-sensitive specimens. Vigorous shaking can hemolyze blood specimens. Question 73. While working in a busy front office, a patient asks the medical assistant to interpret laboratory results. Which response is within scope? Option A, change the results so it appears normal. Option B, diagnose the patient based on abnormal values. Option C, post the result publicly so others can comment. Option D, tell the patient the provider will review and explain the results. The correct answer is option D. Tell the patient the provider will review and explain the results. Interpreting results and giving diagnostic meaning are provider responsibilities. Changing results is unethical and falsifies the record. Diagnosis is outside the medical assistant scope of practice. Public disclosure violates confidentiality and professionalism. Question 74. After reviewing the situation in a phlebotomy station, a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A, keep the surface wet for the full listed contact time. Option B, wipe the surface dry immediately. Option C, use the disinfectant only on clean hands. Option D, dilute the solution more to reduce odor. The correct answer is option A. Keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Removing the disinfectant too soon can make it ineffective. Environmental disinfectants are not hand hygiene products. Unapproved dilution can reduce disinfectant strength. Question 75. Given the workflow in a busy front office, the term dermatology appears in a referral. Which specialty is involved? Option A, kidney. Option B, heart. Option C, skin. Option D, blood. The correct answer is option C, skin. Dermatology is the specialty focused on skin conditions. Nephrology focuses on the kidneys. Cardiology focuses on the heart. Hematology focuses on blood and blood disorders. Question 76. The care team in a women's health clinic asks for guidance because a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A. The pulse oximetry reading will be inaccurate. Option B. The temperature will be elevated. Option C. The blood pressure may read falsely high. Option D. The blood pressure may read falsely low. The correct answer is option C. The blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. Cuff size does not directly determine oxygen saturation accuracy. Cuff size has no direct effect on body temperature. A cuff that is too large is more likely to produce a falsely low reading. Question 77. A medical assistant is working in a community health clinic when the patient asks why they must lie still during an electrocardiogram. Which explanation is best? Option A. The machine cannot record any heartbeat unless the patient holds breath for 5 minutes. Option B. Movement can create artifact that makes the tracing harder to interpret. Option C. Movement changes the patient's blood type. Option D. Electrodes are used only to deliver medication. The correct answer is option B. Movement can create artifact that makes the tracing harder to interpret. Stillness improves the quality of the electrical recording. Normal breathing is usually allowed, but excessive movement should be avoided. Movement has no effect on blood type. Electrodes detect electrical activity and do not deliver medication during a standard recording. Question 78. A medical assistant is working in a telephone triage workflow when a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A. Move all chest leads to the abdomen. Option B. Clean and dry the skin before applying electrodes. Option C. Apply electrodes directly over lotion. Option D. Use tape only and skip electrodes. The correct answer is option B. Clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Incorrect lead placement changes the tracing and may impair interpretation. Poor adhesion can cause artifact or lead loss. Tape cannot record cardiac electrical activity. Question 79. At the start of care in a medication administration visit, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A. Tell the patient dizziness is impossible. Option B. Assist the patient to sit or lie down safely. Option C. Leave the patient standing while searching for forms. Option D. Ask the patient to walk faster. The correct answer is option B. Assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. Dismissing symptoms does not protect patient safety. An unsteady patient should not be left unsupported. Walking can increase fall risk when the patient is dizzy. Question 80. Given the workflow in a preventive care visit, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A. Alveolus. Option B. Axon. Option C. Platelet. Option D. Ureter. The correct answer is option B. Axon. An axon carries nerve impulses away from the neuron cell body. An alveolus is a lung air sac. A platelet is a blood component involved in clotting. A ureter carries urine from kidney to bladder. Question 81. Following office protocol in an infection control audit, the abbreviation NPO appears before a procedure. Which instruction does it represent? Option A. Nasal passage open. Option B. New patient only. Option C. Normal pulse output. Option D. Nothing by mouth. The correct answer is option D. Nothing by mouth. NPO means the patient should take nothing by mouth for the specified period. NPO is not a nasal assessment abbreviation. New patient only is not the meaning of NPO. NPO does not describe pulse measurement. Question 82. Given the workflow in a medication administration visit, the term otitis media is listed in the assessment. Which body area is involved? Option A. Stomach. Option B. Middle ear. Option C. Liver. Option D. Kidney. The correct answer is option B. Middle ear. Otitis media refers to inflammation or infection involving the middle ear. Stomach inflammation is gastritis. Liver inflammation is hepatitis. Kidney inflammation is related to nephritis or pyelonephritis. Question 83. While working in a procedure setup, the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A, patient seems dramatic about ear pain. Option B, patient reports sharp right ear pain for 2 days. Option C, right ear normal after exam. Option D, ear infection diagnosed today. The correct answer is option B. Patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. Subjective judgment is unprofessional and not appropriate for the medical record. Exam findings belong to the provider and are not the chief complaint. A diagnosis should not be documented by the assistant unless the provider has made it. Question 84. An office review in a diagnostic testing area shows that a patient requests an appointment reminder by text message. Which consideration is important? Option A, text any diagnosis to any phone number in the chart. Option B, ignore all reminder preferences. Option C, post the reminder on social media. Option D, follow office policy and patient communication preferences. The correct answer is option D, follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Sensitive information and wrong numbers can create privacy risk. Preferences help guide appropriate communication. Public posting would expose private information. Question 85. An office review in a pediatric clinic shows that the provider is running behind and a patient asks for an update. Which response is professional? Option A, tell the patient that waiting is their only option. Option B, discuss another patient's emergency as the reason. Option C, guarantee an exact time even when it is unknown. Option D, apologize for the delay and provide the best available estimate. The correct answer is option D, apologize for the delay and provide the best available estimate. Clear and courteous updates help manage expectations without blaming others. Dismissive communication is unprofessional. Sharing another patient's situation can violate privacy. False certainty can create more frustration. Question 86. An office review in a family practice clinic shows that a patient is ready for venipuncture and the labels have already printed. Which identification step should be completed before collecting the specimen? Option A, label the tube after returning to the lab. Option B, ask the patient to state 2 identifiers and compare them with the order. Option C, ask a family member to confirm the name only. Option D, use the room number because it is faster. The correct answer is option B. Ask the patient to state 2 identifiers and compare them with the order. Using 2 approved identifiers before collection helps ensure the right test is performed on the right patient. Delayed labeling increases the risk of specimen mix-ups and rejected samples. A family member may be mistaken and 1 identifier is not enough for positive identification. A room number can change and is not considered a reliable patient identifier. Question 87. Before the visit continues in a phlebotomy station, a claim is denied because patient insurance information was outdated. Which front office process helps prevent this issue? Option A, code every visit as preventive care. Option B, use the oldest card in the file without asking. Option C, skip registration for returning patients forever. Option D, verify insurance eligibility at each visit according to policy. The correct answer is option D, verify insurance eligibility at each visit according to policy. Eligibility verification helps identify coverage changes before claims are submitted. Coding must reflect the service and documentation. Old cards may no longer reflect active coverage. Returning patients can have changed insurance or contact information. Question 88. While working in a clinical skills review, a payer sends money with a remittance advice. What does the remittance advice explain? Option A, which vaccine lot is expired. Option B, how the claim was processed and paid or denied. Option C, where to place EKG chest leads. Option D, how to sterilize forceps. The correct answer is option B, how the claim was processed and paid or denied. Remittance advice provides payment, denial, adjustment, and reason information for claims. Vaccine inventory is not the purpose of remittance advice. Electrocardiogram placement is unrelated to insurance remittance. Sterilization instructions are not part of remittance advice. Question 89. During a specialty referral visit, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A, 4. Option B, IM. Option C, CA. Option D, subcut. The correct answer is option C. PA. PA means by mouth and is used for oral administration. For means intravenous and refers to administration into a vein. IM means intramuscular and refers to injection into muscle. Subcut means subcutaneous and refers to injection into tissue under the skin. Question 90. When a patient encounter unfolds in a clinical skills review, a rapid strep test requires a throat swab. Which technique is best? Option A. Collect sputum from a deep cough. Option B. Touch the tongue repeatedly to collect saliva. Option C. Swab the outside of the lips. Option D. Swab the tonsillar area and posterior pharynx while avoiding the tongue. The correct answer is option D. Swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. Sputum is not the specimen used for a rapid strep throat swab. Saliva and tongue contact can dilute or contaminate the specimen. The lips do not provide the specimen needed for strep testing. Question 91. For a patient encounter in a procedure setup, the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A. Below normal. Option B. Around. Option C. Above normal or excessive. Option D. Between. The correct answer is option C. Above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Below normal is indicated by hypo. Around is indicated by peri. Between is indicated by inter. Question 92. Following office protocol in an exam room, the urinary system is reviewed with a student. Which organ filters blood to form urine? Option A. Spleen. Option B. Gallbladder. Option C. Kidney. Option D. Appendix. The correct answer is option C. Kidney. The kidneys filter blood, regulate fluid balance, and form urine. The spleen filters blood cells and supports immune function but does not form urine. The gallbladder stores bile and does not form urine. The appendix is associated with lymphoid tissue in the digestive tract. Question 93. As part of exam preparation in a pediatric clinic, the term hematuria is reported on a laboratory result. Which finding does it indicate? Option A. Air in the lungs. Option B. Protein in the stool. Option C. Blood in the urine. Option D. Sugar in the blood. The correct answer is option C. Blood in the urine. Hematuria means blood is present in the urine. Air in the lungs is not described by hematuria. Protein in stool is not hematuria. Sugar in the blood is described by glycemia terms. Question 94. Following office protocol in an administrative check-in area, the assistant reviews where bile is stored before release into the small intestine. Which organ stores bile? Option A. Spleen. Option B. Bladder. Option C. Gallbladder. Option D. Pancreas. The correct answer is option C. Gallbladder. The gallbladder stores and concentrates bile made by the liver. The spleen is involved in immune and blood cell functions. The urinary bladder stores urine, not bile. The pancreas produces digestive enzymes and hormones but does not store bile. Question 95. Before the visit continues in a certification exam scenario, the assistant needs to keep provider meeting time unavailable for patient appointments. Which scheduling tool is useful? Option A. Sterile field setup. Option B. Matrix blocking. Option C. Coinsurance posting. Option D. Order of draw. The correct answer is option B. Matrix blocking. Matrix blocking reserves time in the schedule for meetings, procedures, or other unavailable periods. Sterile field setup supports clinical procedures, not schedule blocking. Coinsurance posting relates to patient financial responsibility. Order of draw guides blood collection sequence. Question 96. Given the workflow in a patient intake station, the term tachypnea appears on an intake form. Which meaning is correct? Option A. Painful urination. Option B. Slow pulse. Option C. Rapid breathing. Option D. Low temperature. The correct answer is option C. Rapid breathing. Tachy means fast, and near relates to breathing. Painful urination is dysuria. Slow pulse is bradycardia. Low temperature is hypothermia. Question 97. After reviewing the situation in a same-day appointment, lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A. Fifth intercostal space at the left midclavicular line. Option B, a fourth intercostal space at the left sternal border. Option C, a midway between V2 and V4. Option D, a fourth intercostal space at the right sternal border. The correct answer is option A, fifth intercostal space at the left midclavicular line. V4 is placed at the fifth intercostal space along the left midclavicular line. That location is used for V2. That location is used for V3 rather than V4. That location is used for V1. Question 98. After reviewing the situation in a same-day appointment, the provider mentions the largest artery in the body. Which vessel is being described? Option A, pulmonary vein. Option B, vena cava. Option C, carotid vein. Option D, aorta. The correct answer is option D, aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. Pulmonary veins return blood from the lungs to the heart. The vena cava is a large vein returning blood to the heart. Carotid structures are in the neck, but the carotid artery is not the largest artery. Question 99. A medical assistant is working in a treatment room when a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A, record readings with date, time, and relevant notes as directed. Option B, write only the highest number ever measured. Option C, use another person's readings if the cuff is shared. Option D, skip technique instructions because home cuffs are automatic. The correct answer is option A, record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Selective recording can mislead clinical decisions. Readings must belong to the patient. Proper positioning and technique still matter with automatic cuffs. Question 100. After reviewing the situation in a preventive care visit, a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A, referral. Option B, remittance address. Option C, coinsurance. Option D, copayment. The correct answer is option C, coinsurance. Coinsurance is the patient's percentage share of covered costs. A referral is permission or direction to see another provider. A remittance address tells where payments or documents are sent. A copayment is usually a fixed amount rather than a percentage.